The House barely, in a purely partisan move, passed a bill that would take health insurance away from 23 million American people over the next 10 years, dramatically increase premiums to seniors, jeopardize coverage of people with pre-existing conditions, and impose huge burdens on states. One of the reasons the House bill was so bad, condemned even by President Trump, who labeled it mean, was because it flowed from a bad process. The House held no hearings on the final bill. There was not meaningful testimony from patients or healthcare providers. They did not accept any amendments from Democrats, and they rushed the bill through to vote before the Congressional Budget Office could score the bill. So no wonder that the House bill is opposed by the American Medical Association, the AARP, nurses, hospitals, patient organizations, Democratic and Republican governors. And yet the Senate is poised to make exactly the same mistake, preparing a secret bill with no testimony, no public scrutiny, no opportunity for meaningful amendments, no opportunity for Democrats to participate. We have the opportunity to get this right, and we have the responsibility to get this right. There are so many problems with the House bill. As a member of the Health Committee, I went on Friday to the Culpeper Free Clinic in about 75 miles from here to talk about the need for real improvement in our healthcare system, not a repeal that would hurt vulnerable people. And at this clinic, which is celebrating its 25th year, I saw dedicated staffers and volunteers, and I talked to patients. And I talked to them about how this organization has provided compassionate care to working people in this region of Northern Virginia who don't have health insurance. The fact that Virginia has refused to expand Medicaid is one of the reasons that the need for their care is so significant. Fully 70% of the free clinic patients in Virginia would be eligible for Medicaid if the state would just join the 35 other states that have expanded Medicaid. And what I heard at the Culpeper Free Clinic is this: they're already bursting at the seams because we haven't expanded Medicaid. If there are additional cuts to Medicaid, it would overwhelm the ability of the 60 free clinics in Virginia to provide compassionate care. Just a few hours ago, earlier today, I went to Albemarle County near Charlottesville, and I had a roundtable session with educators, families, and children's advocates to highlight another key problem with the Republican approach. By dramatically cutting Medicaid, who is the most likely victim? Children. The most numerous victims of Medicaid cuts are children. In Virginia and nationally, nearly 60% of the recipients of Medicaid are kids. And yet the president, through the Trumpcare bill and the president's submitted budget, proposes to cut Medicaid by $1.3 trillion over the next 10 years. $1.3 trillion over the next 10 years. And this deeply frightens the parents and educators and kids I talked to today. I heard from parents of kids with cerebral palsy and autism, whose kids are receiving support through Medicaid to buy a wheelchair or get services so that they can learn to adjust with autism. And this will help them grow into adults who have a chance of living independently. These parents had heartbreaking stories, often telling me, and this is a quote, "I had no idea the challenges of parenting a disabled child until I had one myself." They view Medicaid as absolutely critical to their children's educational and life success. They talked about the current shortfalls in the Medicaid funding that lead their kids to be put on waiting lists for services. One mom with the child has been on a waiting list for a developmental disability waiver, and I asked her, "What have they told you about the waiting list?" And this was her quote: "They have told me my child will die before he is off the waiting list." And that's under the current program before you cut $1.3 trillion out of it. I heard from school administrators who talked about the importance of Medicaid funding for their programs that serve students. Special ed teachers worried about the effect on their work if Medicaid is slashed. Local superintendents and school board members talked about the difficult challenges of funding their school budgets if Medicaid funding is cut. They posed it as a difficult choice. If the feds cut $1.3 trillion out of Medicaid, do they reduce their funding for their students with disabilities? Or do they take local funds away from other important programs to backstop those programs? Or do they have to raise their own state and local taxes to make up for the federal cuts? I heard from child service advocates today who would see their programs slashed if Medicaid is cut. Here's an example. Many of them serve court-involved young people, not kids charged with crimes, but kids who are in court because of difficult home lives and challenging situations with their parents or guardian. And they're in danger of being pushed into the foster care system or into institutions because of problems at home. Medicaid pays for support services to help stabilize their family lives. If these services are reduced and more children get institutionalized, how does that help anyone? How does it help these kids? How does it help society? How does it help our budget? It's much more expensive to put a child in a group home or an institution than to provide a few hours of Medicaid services in their homes once a week. The 60% of Virginia Medicaid recipients who are children, and the parents and teachers and nurses and others who worry about them and help them, don't see this as a partisan issue. It's fundamentally an issue of compassion. We will and should be judged by how we treat our children. Why slash funds that are used to help our kids? Is it really important to cut Medicaid by $1.3 trillion, hurting millions of children, so we can give a few adults a $900 billion tax cut? We had a budget hearing recently, I'm on the budget committee, with the OMB director, Mulvaney. This was just within the last 2 weeks. And Director Mulvaney tried to reassure us in his opening statement that the Medicaid cuts were really about doing people a favor. He testified, and I quote, "We're no longer going to measure compassion by the number of programs or the numbers of people on programs like Medicaid. We're going to measure compassion by the number of people we get off these programs and back in charge of their own lives." I want to repeat that from the president's chief budget official. We're going to measure compassion by the number of people we get off these programs and back in charge of their own lives. What a cruel thought. That reads like something that a villain in a novel by Charles Dickens would say. But that is the philosophy of this administration and this effort. So will we now tell a kid who loses the wheelchair that is partly paid for by Medicaid, you're now back in charge of your own life? Will we tell a single mom whose child is receiving services to help with autism, but now loses access to these services, hey, guess what? You're back in charge of your own life. Will we tell a teenager in a broken home whose Medicaid services are the only difference between staying in the community and putting in an institution, guess what? You're now back in charge of your own life. And since Medicaid also provides funding for our parents and grandparents who can no longer care for themselves and have to be cared in nursing homes, will we go to those seniors who lose places in nursing homes and say, guess what? Now you're back in charge of your own life. Slashing Medicaid isn't about putting anybody back in charge of their own life. Medicaid enables kids to go to school and succeed. Medicaid enables disabled people to function well enough to go to work and pay taxes. Medicaid enables seniors to receive compassionate care when they can't care for themselves. And cutting Medicaid jeopardizes the ability of people to live with independence and dignity. No, folks, let's not kid ourselves. This is not an effort to empower anybody. It's about casting them aside because they are too young or too old or too sick or too poor. And it's about giving a tax break to some people with the very funds we are taking away from the most vulnerable members of our society. That's why I oppose this mean effort by the majority as a secretly crafted bill to repeal the ACA. We can improve health care if we work together. Let the Finance and the Help committees discuss any bill, hear from patients and providers, allow amendments and debates before rushing anything to a vote that would so cruelly affect the lives of millions and millions of people. And with that, Mr. President, I yield the floor.